First of all, I want to thank you for the hope that you bring, and that will transpose to my question. I perceive as a nurse that a lot of our problems come from mental health. It starts with children who don't have any care. I worked at the VA. I certainly saw a lot of mental health there, and I see it in the surrounding areas. I think that should be a huge agenda item to help with that. What do you foresee that you can do to help with that issue?
Well, God bless you. My daughter's a nurse, and y'all are angels walking on earth. I believe that. Mental health is the cancer America refuses to deal with. 1 in 3 Americans suffer from a mental health issue. But if treated, they can live a perfectly normal life. And now we're seeing more than ever, our kids are having more anxiety, stress, and depression since COVID than we've ever seen. The problem is we don't have enough therapists. We don't have enough mental health centers. If you don't get treated for a mental health issue, you can fall into an addiction. We don't have enough addiction centers. We are losing millions of Americans because we're not treating them. So we will make it a massive priority. And so when we talked about those programs coming down to the states, every state, I'm going to work with every governor in every state to make sure we get a mental health infrastructure up in place so that people can get the help they need. We've got to do it. You know, we talked about veterans, but there are so many. When you think of 1 in 3, we can't let people continue to suffer like this in silence. We've got to make sure we put the resources there.